Tachycardia and hypertension, what is the association? Hypertension is a widely prevalent major cardiovascular risk factor. The risk factors for development of hypertension include age, smoking, alcohol, obesity, diabetes, renal damage, and others. Elevated heart rate is a risk factor of hypertension. A 3 to 4 times higher risk of hypertension has been reported with increase in heart rate even after controlling the traditional risk factors. In young hypertensives, baseline heart rate and changes in heart rate in first few months are found to be associated with sustained hypertension. Increasing heart rate in patients with hypertension is associated with adverse cardiovascular outcomes. Thus, management of raised heart rate in hypertension is crucial. Heart rate has inverse relation with the central aortic pressure, which affects cardiovascular outcomes in patients with hypertension. This has implications in selecting antihypertensive drugs that affect heart rate. A preference to the drugs like newer beta blockers which reduce heart rate as well as peripheral and central pressure is advised. An increase in the resting heart rate is associated with increased risk of incident hypertension. A linear association may be observed in individuals with HR greater than 80 bpm. Each 10 beats per minute increase in resting heart rate can substantially increase the risk of adverse cardiovascular and mortality outcomes, and on treatment heart rate can provide a better prognostic guide. Ambulatory heart rate with daytime and nighttime heart rate may also have different impact on outcomes. Heart rate below 70 beats per minute on beta blocker treatment is advised, which may further be lowered in patients with comorbidities like heart failure and coronary artery disease. Reducing resting heart rate by at least 10 beats per minute from baseline may provide benefits. There should be self-measurement of heart rate in patients who can manage at home. In patients with high heart rate in clinic, ambulatory heart rate measurement should be considered. Look for secondary causes of increased HR. There should be emphasis on improvement of lifestyle. There should be dietary modification for weight control. Selective beta blockers have to be considered in symptomatic patients. Adopt healthy lifestyle approaches to keep check on blood pressure and heart rate. Use selective beta-1 blocker in symptomatic cases with elevated heart rate beyond 80 to 85 m of Hg. Reducing heart rate in hypertension improves the cardiovascular and mortality outcomes.